everyone, and welcome to Hi-Fi Health News. I'm Erika Grotto. If you get your health insurance on the marketplace, be prepared for a big rate hike next year. Here to tell us more is Nick Hutt, a senior editor at the Healthcare Financial Management Association. Nick, I'm seeing some pretty big increases here, like 75%. Why is there such a big difference?
So there are two things going on. The big one is that as things stand, increased subsidies for buying this insurance are set to expire going into 2026. That's if Congress does not renew them, and it remains to be seen whether the GOP majorities have any interest in doing that. And if not, then there will still be subsidies available, but not for as many people and not covering as much of the premium cost for those plans as the subsidies that have been available over the last few years. And then what's also happening is that the insurers that sell these plans are reacting to the marketplace uncertainty brought on by several policies, including the expiration of the subsidies. And they are increasing the premiums they'll charge for 2026, generally by around 10 to 20%, in some cases over 20%. And this could all add up to a doubling of premiums for some folks.
We saw a lot of people getting insurance coverage from the marketplace when premiums went down during the pandemic. Do you think the inverse could be true this time and people will just discontinue their coverage because it's too expensive?
Very possibly. The nonpartisan Congressional Budget Office has projected that 2.2 million additional people will be uninsured in 2026 as a result of these subsidies expiring, assuming they do. That's, of course, because plans would get more expensive and people would be either unable or unwilling to pay for healthcare coverage. And some additional number, surely well into the millions, would drop out of Obamacare and find other insurance that may or may not be of equal value.
So for folks who are watching who might be on marketplace plans, they're getting concerned about the cost of their insurance coverage. What's your best advice for next steps?
Well, as we get closer to 2026 enrollment, which is set to begin November 1st of this year, you'll want to use healthcare.gov or your state Obamacare exchange to estimate what you'll have to pay so you don't get caught off guard. And maybe keep an eye on the news headlines to track whether Congress does in fact let these higher subsidies expire. And then think about possible alternatives. Medicaid might be one, depending on your income bracket and whether you live in a Medicaid expansion state. Some people on Obamacare have had access to employer-sponsored insurance, but chose not to sign up, just because of the cost. Now, maybe they could revisit that option. And then there are what are called short-term limited duration insurance plans, which are pretty good about covering you in case of catastrophe, but aren't very comprehensive otherwise. And there are things to be aware of with those plans. For example, if you have a pre-existing health condition, they might choose either not to enroll you to begin with or not to renew your plan if you've had one.
We will certainly be watching this and updating as developments come. That's it for us today. I'm Erika Grotto for Hi-Fi Health News. Thanks for watching.